Your Medicare card may be close to useless overseas, and your American health insurance card may be a lot less helpful than you think when a foreign hospital asks how you're going to pay. Jeremy here, obviously English, but have been living in the United States for over 20 years. Today, we are looking at what actually happens when an American gets hospitalized abroad. From the ambulance and hospital deposit to Medicare, the embassy, medical evacuation, and the insurance claim afterwards. Not the brochure version, the actual sequence of events when something goes wrong and you are trying to make decisions while injured, frightened, and nowhere near home. Right, let's set the scene. You are in Thailand, Portugal, Colombia, or Japan when something goes wrong. Maybe it is a motorbike accident, chest pains, or one badly judged step on an uneven pavement. Within seconds, your holiday has become a medical situation. First question, who calls for help and what kind of help actually arrives? Emergency response varies enormously by country and location. Major cities in many popular destinations have good to excellent emergency facilities. Rural areas and smaller islands can be a very different story, with longer response times and much further to travel for specialist care. In some places, public and private ambulance services operate side by side, and the experience can vary significantly. That is worth knowing before you book the remote villa with the magnificent view and absolutely nothing resembling a trauma center nearby. Before a longer trip, it is worth knowing the local emergency number and where the nearest serious hospital actually is, not simply the nearest clinic that happens to appear on Google Maps. Now you arrive at the hospital, and this is where the financial reality starts. In many destinations, you may have a choice between a public hospital and a private hospital. Public hospitals serve the local population and can be extremely capable, but they may also be crowded or difficult to navigate if you do not speak the language. Private international hospitals can be excellent, particularly in major cities such as Bangkok, Kuala Lumpur, or Mexico City, but they are still businesses. And hospitals abroad may ask for proof of insurance, a deposit or some form of payment guarantee before or during treatment. The US State Department specifically warns that in many locations, payment or a deposit may be required before services are provided. Depending on where you are and what treatment you need, that can mean putting a substantial charge on a credit card before you have had much time to process what is happening. So, does your American health insurance cover it? Maybe, and that word matters a lot. Some US health plans provide emergency coverage overseas, and some employer or Blue Cross Blue Shield plans include international benefits. Others provide very little or nothing outside the United States. You need to check your actual plan rather than assuming the card in your wallet travels with you. Marketplace and domestic-only policies can be particularly limited internationally, so ask your insurer specifically what happens if you need emergency treatment outside the United States, whether the hospital can bill them directly, and whether you have to pay first and claim later. And then there is Medicare. Original Medicare generally does not cover healthcare outside the United States, apart from a few narrow exceptions. So for the typical American holidaying or living in Lisbon, Chiang Mai or Medellin, Medicare is not the safety net many people assume it is. Some Medigap plans offer limited foreign travel emergency benefits, and some Medicare Advantage plans may include emergency or urgent coverage abroad. But these benefits are plan-specific and limited. Certain Medigap plans, for example, may only a percentage of covered foreign emergency costs and are subject to plan limits. They are not a substitute for understanding your actual international medical coverage before you travel. Right, back to the hospital. At some point, somebody holding a clipboard may appear and ask how the bill is going to be paid. In some hospitals, you will be treated first and billing comes later. In others, particularly private facilities, you may be asked for a deposit, credit card authorization, or confirmation from an insurer. If you have travel medical insurance with emergency assistance, this is when you call the assistance number. Depending on the policy and hospital, the insurer or assistance company may be able to coordinate with the facility or arrange a payment guarantee. If not, You may have to pay yourself and seek reimbursement later. That means having access to enough credit or emergency funds to deal with a bill that was definitely not included in the holiday budget. Now let us talk about something Americans sometimes overestimate: the US Embassy. The embassy can help you find local doctors or hospitals, contact family, and explain options for getting money sent to you. In limited circumstances, emergency financial assistance may be available as a repayable loan for destitute US citizens, including some emergency medical situations. But that is very different from the embassy simply paying your hospital bill or arranging a free flight home. The US government is not your international health insurer, and it does not become one because the situation is frightening. Then there is the question nobody wants to ask. What happens if the local hospital cannot treat you? That is where medical evacuation comes in. You may need to be transferred to a larger city, a regional medical center, or in serious cases, transported by medical escort or air ambulance. And this is where costs can become extraordinary. The US State Department says air ambulance evacuation back to the United States can cost anywhere from around $20,000 to $200,000 depending on location and condition. This is why the exact wording of evacuation coverage matters. Many policies cover evacuation to the nearest appropriate medical facility. That does not necessarily mean flying you back to your preferred hospital in the United States. Repatriation home may be a different benefit with different conditions. So when comparing insurance, do not stop at the words medical evacuation included. Find out where they are allowed to evacuate you, who decides it is medically necessary, and what the policy limit actually is. The same applies to repatriation of remains in the event of death abroad. It is unpleasant to discuss, but transporting a deceased traveler internationally can be expensive and complicated. If that matters for your trip or family situation, check whether it is covered rather than assuming. Once the emergency is over, the insurance claim may just be beginning. Keep everything you think you need, and even the stuff you don't think you need for this next stage. Medical reports, itemized invoices, receipts, prescriptions, proof of payment, discharge paperwork, any emails or reference numbers from the insurer's assistance line. If you pay anything yourself, make sure you leave with documentation showing exactly what you paid for. Some insurers can arrange direct payment in certain circumstances. Other claims work on reimbursement. Either way, travel medical claims depend heavily on documentation, and missing paperwork can turn a straightforward claim into a very long email relationship with somebody called Claims Department. Then come the exclusions. Pre-existing conditions are a major one. Some policies exclude them, some offer waivers or limited coverage, and the definitions vary. If you already have a medical condition, read that section before buying. Trip duration limits matter too. An annual policy does not necessarily mean every trip can last an entire year. Some policies cap each trip at a set number of days, so a long stay abroad can fall outside the cover you thought you had. Activities are another trap. Motorbikes, scooters, diving, skiing, and other activities may come with license, helmet, alcohol, or optional coverage requirements. The fact that an activity looked perfectly normal on Instagram does not mean the insurer has agreed to pay for the consequences. And if you have more than one type of insurance, check how the policies coordinate. One may be primary and another secondary, which can affect which insurer you contact first and what documentation is required. Do not wait until the claim is open to discover that two insurers are both waiting for paperwork from each other. Right. This is where EKTA comes into the conversation. EKTA offers travel medical products for international trips, with options that can include medical treatment depending on the policy selected. If you are traveling abroad and your US coverage is limited, it may be worth comparing alongside other international medical options. But do exactly what I have been telling you throughout this video. Read the policy. Check the age limits, pre-existing condition terms, trip duration limits, deductibles, exclusions, coverage territory, evacuation terms, and whether you must select any special option if you are already traveling. There is an EKTA link below in the description if you want to compare EKTA for yourself. Do not buy any policy because I said the name on YouTube. Buy it because you have read the terms and it actually fits your trip. So what does all of this mean in practice? The Americans who handle medical emergencies abroad well are usually the ones who did the boring preparation before anything happened. They checked whether their US plan covered overseas emergencies and whether they would have to pay first. They understood that Medicare generally does not travel with them. They had appropriate travel medical or international coverage. They saved the emergency assistance number somewhere other than an email they might not be able to access. And they knew whether evacuation meant the nearest suitable hospital or a flight home. Most importantly, they did not wait until somebody was asking for a credit card in a foreign emergency room to discover what the words on their insurance policy actually meant. Healthcare abroad can be excellent. In some countries, it can also be dramatically cheaper than equivalent care in the United States. But cheaper does not mean free, and excellent healthcare that you cannot immediately pay for creates its own kind of problem. So the lesson is not that overseas healthcare should frighten you. Traveling without understanding how you will pay for it should. If this video has been useful, please hit like and subscribe to Jetset Jeremy. There is another video appearing on screen now or soon that connects nicely with what we have covered today, so go and have a look. Right then, that is your lot. Know what your insurance covers before you board the plane. Understand that Medicare generally does not travel. Keep your paperwork and do not rely on the embassy to pay your hospital bill. This has been Jetset Jeremy. Stay curious, stay covered, and for goodness sake, read the fine print. Cheers.